Hi, how are you? I'm student Dr. Whiting. How are you?
Nice to meet you.
I understand you're having some hand pain, is that right?
Yeah, I've had just some trouble in my right wrist and my fingers are kind of going numb.
Okay.
And it's just been hurting.
How long has it been doing that?
On and off for a couple months, but it's gotten worse recently.
Okay. Is it worse at any particular time of the day or night?
Well, yeah, I mean, I work at one of the fabric factories, and I have to do this all the time. So it just starts to hurt when I'm at work.
Okay. So is it worse when you're at work?
When I get home, yeah. It's usually worse when I get home.
Okay.
Because I'm moving too fast at work, I can't pay attention to it.
Okay. Is it worse at any particular time? Like, is it worse at night than it is during the day, or not necessarily?
I haven't really paid attention. It hasn't kept me from sleeping yet.
Okay. All right. Have you noticed anything, for example, like numbness or tingling at all in addition to the pain?
Yeah. Sometimes my fingers go numb. Like on the drive home, sometimes my fingers are numb.
Have you ever reached out to grab something and thought you had a pretty good grip on it, but you really didn't, and you either dropped it or almost dropped it? Have you ever had that happen?
No, not really, not yet.
Okay.
I haven't noticed that.
Any problems with the other hand?
Not so much because I'm right-handed, so the
Okay.
left hand doesn't really bother me.
Okay, so it's mainly a right-handed thing?
Yeah.
Okay. Well, let's take a look at your hand if we could.
Okay.
All right. So let's see. Spread your fingers apart. Okay, good. Spread them apart again. Don't let me pull them together. All right. Put your thumb and your index finger together like that. Don't let me pull them apart. Okay. Turn your hand over this way. Stick your thumb straight up in the air. Don't let me pull this down. Does that bother you at all?
Yeah, that kind of makes it worse.
Okay. Does it hurt? Does it hurt down in here?
Oh, yeah, that really hurts.
Okay. How about can you put your hands together like this and kind of press them together? Does that hurt to do that at all?
Yeah, that kind of hurts.
Okay. How about if we do it this way and just kind of push them together? Does that bother you at all?
Yeah, my fingers are sort of going numb.
Okay. All right. Does it hurt up in here? Does that bother you?
No.
Okay. How about right in here? Does that bother you at all?
No.
Okay.
Really.
How about hold your finger like that and don't let me pull it over? Does that bother you at all?
A little bit.
Okay. Squeeze me really hard. Hurt me. Okay? Good. Let's check over here. Oh, and let's do one other thing. Close your eyes. Can you feel me touching you on both sides?
Yep.
Does it feel the same on both sides?
It's a little bit less on this side.
Less on this side. Okay? And how about here?
No, that's about okay.
Okay? How about over here?
Yeah, that's fine.
Okay?
Same on both sides.
Okay. All right. You can open your eyes. Let's see. Does this bother you?
Nope.
Okay. Spread your fingers apart. Don't let me pull them together. All right. Thumb and index together. Don't let me pull my finger out. Good. Let's see. Squeeze me really hard. Okay. Good. And turn your hand over. Stick this thumb up in the air. Don't let me pull it down. All right. And now we're going to pull this finger over. Don't let me push your finger over this way. Good. Now, does it hurt in here at all?
No.
And how about up in here?
Nope.
Does that bother you at all?
Nope.
Okay. Okay. All right. I think that you might have carpal tunnel. There are a few other things that it might be, but I think you have carpal tunnel syndrome.
Okay.
And that's where there's a nerve that goes down from your arm down through your wrist into your hand here, and it's the nerve that gives you strength and ability to feel kind of in this part of your hand. I'm thinking that's what it is. So I'll talk with Dr. Routman, my attending, and see what he says, and then he'll probably come in and examine you and see what he thinks.
Okay.
All right, thanks.
If you don't mind, I'm going to sit down on the table next to you, and we're going to discuss what our student doctor did here,
Okay.
Mr. Franco.
Well,
So-
I think that Ms. DeFranco has carpal tunnel syndrome. She's had pain in her hand, and it seems to be getting worse, and it's bothering her at work. It seems to be worse at work. She hasn't noticed any problems at night yet, but it looks to me like she has some difference in strength between the right and left side on the hands, in grip strength. She has, it hurts whenever I did the Tunnel's test, and whenever I did the Phelan's test, that was positive as well.
Okay.
So I think she has carpal tunnel syndrome.
Okay, well, I have one question for you to begin this. Which hand?
Oh, I'm sorry, it's the right hand.
Oh, okay. You really should start with that because your supervisor needs to know which hand you're talking about.
Okay.
What other things could it be? You tell me that she has a positive Tunnel's and a positive Phelan's. How's the strength?
Her strength is a little bit diminished on the right side compared to the left in terms of not only grip, but her ability, when I ask her to spread her fingers, to hold them apart.
Okay.
I thought she might possibly have Pronator Syndrome, where the median nerve gets entrapped proximally.
Right. And why doesn't she?
But I palpated up there at the pronator teres muscle, and typically when it gets entrapped, there'll be pain there, and she didn't have any pain. I also thought about the possibility of arthritis in the
Yes.
CMC joint in the thumb, but I palpated there, and she didn't complain of pain there, and she didn't have any pain when I palpated there as well. So I didn't think that was the case. An ulnar nerve problem could cause hand symptoms like this, but I tested her first dorsal interosseous
Okay.
and did manual muscle testing on that, and that was, not only did she not have pain when I did that, but it was equal on both sides. So
Okay.
I don't think there's an ulnar neuropathy, so that's what kind of makes me think. And she said that it was primarily this side of her hand, so that's why I'm thinking it's probably a median nerve problem.
Okay, now, have you thought about possibility of diabetes or thyroid disease?
Causing carpal tunnel?
Well, you don't know for sure it's carpal tunnel yet, do you? That was your basic diagnosis, but in a differential diagnosis, you've got to add in some of the other things that could cause this kind of pain. Her complaint wasn't, I have carpal tunnel syndrome. Her complaint was, I have pain in my wrist. So, did you check the muscle stretch reflexes?
No.
I think that would be necessary. And how about the lower extremities? Did you do any check on the lower extremities at all to compare them with what you found in the upper extremities?
No, I didn't.
Okay.
I didn't.
Well, you need to go a little bit farther when you're going to come to a diagnosis like carpal tunnel. Granted, this is probably what she has. I agree with you on that. However, you have to rule out other possible causes of this pain before you can hone in on carpal tunnel syndrome. Because what is the treatment for carpal tunnel syndrome?
Well, you might do some bracing. You might put her on
Okay.
a wrist splint. We might use anti-inflammatory medications. We might use steroids. And of course, if she's diabetic, that might be a problem. We might use a therapeutic injection or OMT or...
Okay. And what would be the final step if all of this doesn't work?
Probably see if there's been nerve damage with maybe EMG testing to see if maybe surgery might be, decompression might be appropriate.
Right. So after you've gone through everything, you will come to the point where this patient will have an EMG, which probably will be positive if she has carpal tunnel syndrome, and she's headed for the OR. Therefore, you want to check everything that can contribute to this kind of a problem and rule out all the other things that could cause this before you want the patient to end up in an OR.
Is it possible she could have carpal tunnel along with some of these other things too? Like
Yes.
diabetes? Okay.
Of course it is.
Okay.
But you did a good workup for the most part, and your differential, you got the one main thing, and you ruled out most of the other ones, so that was a good job. Your treatment is right on. The only complaint I have is you need to wear a white coat, professional dress, or scrubs.
Okay.
Okay? Outside of that, good job, and we'll go ahead and get you treatment like the student doctor said, and we'll see if we can get this thing under control.
Okay, thanks.
Okay. That was